I'm Dr. Bret Christensen, and today I want to talk to you about adult sleep apnea and adult sleep disorders. And you might say, why is an orthodontist talking to you about adults that have sleeping disorders? Well, over the years I've found that a lot of the patients that we have that come in for orthodontic treatment that have very constricted upper jaws, crowding in the upper jaw, and deficiencies of the lower jaw, and our treatments of those patients is something that would actually correct sleeping disorders like sleep apnea. And so I have patients that we have had to, for their treatment to correct their bite, we've had to go in and expand and grow their upper jaw, and also to bring their lower jaw forward. Well, as an adult, the treatment of that actually requires a surgical procedure, and the people are ready and willing to do that to get their bites corrected. But what we've found is after we correct that, there's actually a bigger, more kind of a long-term health issue that has been corrected, and that is helping them to breathe and to sleep better. And how that works is if we go in and we actually grow the upper jaw, and we actually use an oral surgeon that helps us do that. We grow that upper jaw wider, that opens up the nasal airway. And people that have a deficient lower jaw, they have a surgical procedure that brings their lower jaw forward, and that pulls the tongue out of the back of the throat. So in sleep apnea, when somebody stops breathing, their tongue actually drops into the back of their throat and occludes the airway. And so it's people that don't have a malocclusion, don't have a big overbite, we've actually been treating those patients with oral appliances where we have it's kind of like a mouth guard that fits on the top teeth and the bottom teeth, and it has either some springs or some ramps that take the lower jaw and bring it forward and pulls the tongue out of the back of the throat. And we've had tremendous success. Pretty much every patient that we've treated has had an improvement in their sleep, whether they've stopped snoring or stopped with the apnea. And so as an orthodontist, we're the ones that deal with the teeth, and the appliances go on the teeth. And so we are treating patients that have sleep apnea that are in their 20s and clear up into their 70s and 80s. To be able to treat somebody that has sleep apnea, you have to actually diagnose it. And so the first thing that we do is we will get a home sleep study done. And this little apparatus right here would fit on the forehead, and there's some different devices that measure your oxygen saturation, and it actually measures your blood pressure, it's got an EEG, EMG. It also measures the airflow that you're doing, and it can measure when you stop breathing and what happens when you stop breathing. And people that have sleep apnea, when they stop breathing and their airway is obstructed, what will happen is with them not breathing, their oxygen in their blood starts to do what's called desaturation. And this device, we've seen people that have desaturated clear down into the 80 percentile with their oxygen. Now, most of us, if we tried to stop breathing, normally our oxygen saturation is around 96% in our blood. If we tried to stop breathing at about 92%, we would pass out or faint. And so when we have a patient that is tested for sleep apnea and their oxygen saturation drops down into the 80s, what's happening is every time they stop breathing, you're basically killing brain cells, but also you're killing the myocardium, which is the heart muscle. You're having lung issues. Everything that goes along with this, basically whenever you're doing it, you're dying. And so whether it takes orthodontics and a surgical procedure to correct this, or a simple oral appliance that takes and brings the lower jaw forward to allow you to open up that airway, that right there is I mean, it's huge for your overall total health. And so, if you know of anybody that is a snorer, or that stops breathing when they're sleeping, we provide a free consultation, and in that consultation we have two devices that we use. One's called a rhinometer and the other is a pharyngometer. And with those, we can actually map the nasal airway and know where the constriction is, so we know what we need to do. And the pharyngometer actually maps the oral airway clear down into the pharynx. And so we can know exactly where and how far to take and move the jaw to get that full correction. And that initial screening is free. And we want anybody and everybody that has this to have that screening to rule out the more serious issues.